We are all so busy these days, and we're always looking for helpful tips and advice on how to find a better work-life balance. We all have to earn a living and pay the bills, but are you doing enough to look after yourself and your health at the same time? Now, many of us prioritise careers and work, and we're slaving over our computers and mobiles all the time. But does this make you cut corners on your diet, exercise or sleep? I'm Dr. Ben Sinclair, and welcome to Health versus Wealth with Dr. Ben. Our guests share their life experiences and we discuss their challenges in their health and their wealth. I hope their experiences will help you with your life and health. Joining me today is highly experienced clinical psychologist Dr. Jared Watson. Originally, he's from New Zealand and he's the son of a vicar. Jared moved to the UK in 2016 and he now works supporting people with severe and enduring mental health issues such as schizophrenia, bipolar and other disorders. Now, in his second role, he also works with NHS staff who have mental health issues around work and stressful lifestyles. Jared has some interesting views on the causes of the rising mental health crisis in the UK over the past 20 years. But first, welcome to the show, Dr. Watson.
Thank you, Ben. Great to be here.
So you didn't follow your father into church work then?
No, I didn't. I grew up in a family where we went to church regularly, and I still do go to church. But I never really aspired to follow in my father's footsteps, to be honest.
And your mother was a counsellor?
She was a counsellor and a chaplain, actually. So to be honest, I didn't really want to follow in her footsteps either. But in the end, I think I have ended up in a role much more like hers. Yeah.
So initially, I hear you were interested in commerce and marketing.
Yeah.
When and why did you switch to psychology? Can you tell us more about that?
Yeah. So I started off studying commerce at university. I really enjoyed it and still do enjoy, marketing, strategy and so on. But it was at university where I was doing some psychology electives that I really discovered and fell in love with psychology. In particular, I love the scientific study of human behavior, and I also loved that I could see how it would benefit and help people, and that was something that I found really interesting and motivating. I really wanted to work in an area where I could help people, where I could relate to people. So through that, I decided to pursue study as a clinical psychologist. And
I have to congratulate you because you just got your doctorate.
Yeah, well, so I studied in New Zealand as a clinical psychologist. I'm a Kiwi. A long time ago, actually. I've worked as a clinical psychologist for 18 years, but in the last 3 years, I've actually done some further study. I've done a doctorate as well, which was really about getting back into research and specialising in a particular area of study. So, yeah.
Fantastic. Now, so that makes you Dr. Watson. Sadly, I'm not Sherlock Holmes.
Yeah.
But it'd be great if we were the double act, wouldn't it?
Yeah.
Because I'm not really as clever as Sherlock Holmes, but it would be nice to have that kind of amazing brain to intuit everything that was going on around us, wouldn't it?
Definitely, yeah.
Now, you work with a range of patients, NHS workers. What kind of issues do they seek your support with?
So the NHS workers I work with typically are experiencing problems like really high stress, burnout, problems with their work colleagues, so interpersonal difficulties, problems coping with regulating emotions at work, and also just with underlying mental health issues, so depression, anxiety, and often these are impacted by the stressful environment that we work in the NHS, but also wider factors such as social media. There's certainly, I think, been a lasting effect of the pandemic on NHS workers. So those are the sorts of issues that tend to come up in the work that I do with NHS staff.
Definitely. Yeah. And the pandemic was interesting, isn't it? Because we went as a society from praising health workers, banging our pots and pans at the front door, to then slating them in a sort of political diatribe in the next minute when there was a sort of political agenda. And it just seems so ungrateful after the pandemic was won, that all these people then just back to work, and you've got to work double hard.
Exactly, and I, do you know what, I think NHS workers really do feel that. So we've very dedicated. People have really worked hard during the pandemic, but then once it's been over, it's kind of like now there's this expectation that we sort of mop up all of the kind of wait lists and residual demand for services that have really emerged out of the pandemic, with no real sort of thought for how NHS workers might still be struggling. So yeah.
And I think some of these people probably were the ones who put their own emotions on one side during the pandemic to help others in a very altruistic way.
Yes.
Some of them were even called out of retirement
Yes.
into very stressful situations with people dying, a lot of uncertainty, a lot of restrictions on them and their family with how they worked.
Absolutely. And I do think that, the pandemic was hard for everybody. It led to, there was all the uncertainty, the loss of social contact, isolation, sickness, long COVID, all these types of issues. But I think for NHS workers, we were dealing with that, plus all of that additional stress and burden of having to care for people, to work in these very difficult, challenging work environment. And also there was this, public expectation that we carry on providing a service. There was a lot of that too. So yeah, I think it was challenging. And I do think that we still see some of the impact of that on NHS workers at all levels of organisation. So, frontline, managers, even, execs and so on. Yeah.
Completely. And I can relate to that because I was a medical director level running 14 prisons in the West Midlands. I got hit with acute COVID and completely taken out and struggled to come back to the workplace with symptoms. Probably have a bit of PTSD about that actually, because really? I was working in prison. It was very demanding, and physically I was so weak, but I had to be, fit to withstand that robust environment if someone took a swing at me. Yeah. So I didn't go back for some time.
And how do you think that's affected you subsequently?
Well, I actually left prison
Really?
because I realised that actually in that environment, I was very, very stressed.
Yeah.
And so just like the people you're working with, I had that moment of realization. I thought, wow, actually, I need to do something different.
Yeah.
And so I actually started working privately for Dr. Finlay's private practice, trying to prevent things from happening rather than treat them after the fact.
Yes, that's right.
Became very busy in long COVID as a specialty because I'd learned lots of ways of treating it as a sufferer myself. And as a result, we now employ a specific long COVID psychologist for our patients because of the particular demands of that patient group. So I think what you're doing, for organisations and teams is really important. We mustn't forget the individuals in those teams.
Exactly. And so I think working with individuals is really important, and that's a big focus for me at the moment. I work with individual employees, managers, executives who might want to optimise their functioning at work, develop their leadership skills, but also work on any mental health difficulties they might have as well. And it's often within that environment that someone who is struggling may open up and talk a bit more about their mental health difficulties, but also working with teams as well and managers and leaders, because organisational culture is so important as well when thinking about the well-being of staff and coping at work. We have to really look at both of those levels, the individual and the organisational level.
Now you mentioned social media earlier when we were talking. What do you think the positive or the negative influences of social media have been in mental health diagnoses in the last 20 years?
That's a really good question. I think that social media has played a really positive role in terms of raising awareness, also reducing stigma. So people are much more comfortable talking about mental health difficulties. People have a much more sophisticated understanding of mental health difficulties as well. So I think that's been the positive impact of social media. However, there's undoubtedly been a negative consequence as well. And I'm sure, people listening to this will be aware that social media, when people post on social media, they tend to curate what they post. They post the highlights of their life, or they post the kind of shiny, positive aspects of their life, and no one tends to post, those periods or times in their life when they're struggling, when life is hard. So that it's called the highlight reel effect, where you just post highlights. Obviously, people then see that, and their view is that people are living these amazing lives. My life's not like that, and they unfavorably compare themselves to people on social media. And in the long term, it's a subtle, but it's a pervasive effect. In the long term, that just affects a person's mood, affects their self-esteem. Similarly for things like body image, people look at social media and look at these people who have these amazing physiques, bodies, and unfavorably compare themselves. So that leads to a loss of self-esteem. And those with body image issues, social media can be actually quite toxic for that reason. So, social media is positive, but it's also it has a number of negative side effects, and I think it needs to be carefully managed. And people need to, I think, moderate how long they're on social media. And actually, there's research that's found that people that have a break from social media report an improvement in their mood and also a reduction in loneliness as well. So there is actually studies to support that.
Welcome back to Health versus Wealth with Dr. Ben. My guest today is Jared Watson, a personal and workplace performance psychologist, and we've been talking about the impact of social media. Now, Jared, tell us what, in your opinion, are the causes of the rising mental health diagnosis these days?
I think it's a fairly complex issue. I think a significant reason for the rise in diagnoses is the cultural shift, that there's greater awareness around mental health difficulties, the prevalence of it, and the fact that a significant proportion of society experience some form of mental health difficulty. So with this understanding, I think there's been greater openness, there's been a reduction in stigma, and I think the mantra "it's okay not to be okay" captures this. So people are much more comfortable being open, vulnerable about their struggles in life. Whereas I think historically, people felt a lot of shame and stigma about when they were suffering from mental health difficulties, and so would tend to hide those, conceal those from others. So I think that's a significant reason, this cultural shift towards openness, probably paralleling that of the issue of menopause, for instance. So there's been a journey over the past 20 years. Actually, you might be able to tell me a bit more about that, Dr. Ben. But my perception is that there is a greater openness to this issue.
Yeah, absolutely. And it's a really interesting journey because the two are linked. So
Really?
In the workplace, a couple of high-powered people in banks in Europe committed suicide. And that resulted in mental health awareness being born as a sort of a workplace need.
Yeah.
Because no one knew that they had any problem at all.
Yeah.
People then realised we need to have more awareness.
Yeah.
And so this mental health awareness movement was born. That drove the "it's okay not to be okay" thing that you mentioned. And then out of that, a lot of women who are in the workplace at the peak of their careers were suddenly being diagnosed with a lot of mental health disorders for the first time. But actually, a lot of that was actually perimenopause and menopause.
Yeah.
And so at Dr. Finlay's, we've now got an online menopause clinic to look after people who've actually had hormone-related mental health deterioration.
Oh, I see. Yeah.
So the one drove the other.
Yes.
I think it peeled off the lid and said, hey, it's okay not to be okay. And women in the workplace were then going, well, why am I anxious for the first time? Going to their doctor, being put on, maybe antidepressants as the first line, or being given CBT.
Yeah.
But that didn't fix it.
Yeah.
There was a hormonal thing. So you need both and.
Yes.
So I think also companies have got quite into retaining their staff.
Yeah.
Younger people joining the workplace now really look for what are the benefits? How are you going to look after me?
Yeah.
Companies have to prove to their employees that they're worth staying there.
Yeah.
And so part of this mental health awareness is to also say, look, we're aware of your needs. We're going to look after you.
Yeah.
And some companies are better than others. There's
Yeah.
greenwashing in some places where
Yeah,
people
yeah.
say they're eco and actually they're not.
Yeah, that's right.
I think there's a mental health awareness sort of tokenism
Yes.
sometimes.
Yeah, yeah.
You've
I
probably
agree.
come across that yourself.
Yeah, that's right. That's right. I think there is a lot of variation between organisations in terms of how they approach this issue. There is, I think, publicly, as you say, there's this motivation to appear like organisations care about the mental health of their employees, but I think it is done quite differently, and I think there are ways that organisations can do that I think that is really effective as well, and that's really what I'm interested in is working with leaders to develop a culture and develop systems that within the organisation that support staff's mental health, and also helping them to access staff wellbeing services or mental health services. Yeah.
And they're so common. I mean, so many of us post-pandemic have had mental health problems. Again, I look at this in the broader sense, not just because we had 3 years of our lives shut down, but also because COVID can cause a lot of mental health disruption, the actual physical effects of the virus. So at Dr. Finlay's, we're looking after loads of people who are post-COVID, who had long COVID. And that destroys your ability to have a social life. It destroys your ability to work.
Yes.
You're isolated because you can't engage. And how do we engage these days? Through social media.
Yeah.
But blue screens and concentrating on them makes people with long COVID actually get physical symptoms like headaches.
Yes.
So actually, there are multiple drivers into a negative mental health status, alongside perhaps a helpful awareness. Maybe that's the thing that's driving this greater diagnosis then.
Yeah, it's a really interesting question actually, and there's various views on it. Is the higher rates of diagnosis due to this increased awareness that we've been talking about, or is there actually something occurring in society whereby there are higher rates of mental health difficulty? And I don't think there's a clear answer to that, although I have recently heard some research that said that they believe that there is actually a slowly increasing rates of mental health distress in the community for the reasons I think we're discussing. One of the hypotheses around this is actually the greater rates of loneliness. So people feel more lonely. Again, that could be related to social media. The other factor that has been hypothesized is there's a greater tendency now to compare ourselves to others. And again, that's could be related to social media as well. So these two factors, one of social isolation, two of comparing ourselves a lot more to others, appear to be driving or having a very detrimental effect on mental health, and possibly driving these increased rates of mental health distress.
There's so many different factors here, and we can never pinpoint one, because looking backwards, often you can say, "Oh, that was a significant event." This started off that movement or that awareness. The other thing I think we haven't talked about is epigenetics.
Yes.
So the science of epigenetics is growing, and what this essentially is that if your parents have undergone unprocessed trauma, that is locked into their gene code, and therefore when they then have a child, that child inherits a genetic fragility, which often presents itself as a mental health disorder such as anxiety, and that then can skip generations. If you have let's suppose there's a woman in an abusive relationship and she's pregnant, so that stress, the stress hormones that she's experiencing when she's being abused actually get transmitted into the unborn child's eggs, so they can go to her grandchildren, and this may be why we now may be having the epigenetic changes from the Second World War coming into this generation.
That's fascinating.
With a rise of autism, with a rise of anxiety, school refusal, and that blows my mind, because I'm like, well, how can we prevent that? And the answer to that is it's only 20% genetics, 80% environment. If you have trusted adults who you can share your concerns with when you're going through a traumatic episode, you can reduce the risk of passing that on. And this is all around the adverse childhood experiences sort of theory as well.
That's right.
So someone like you is very useful, because you're processing people's trauma as they're going through it. And boy, do we have a lot of traumatized NHS staff right now.
Absolutely,
most of my doctor friends I have so much respect for, who are still working in the NHS, are absolutely up against it. And they need a psychologist. I wish we could offer you to everybody, Jared.
And I just completely agree with what you're saying. I mean, there's research I was reading recently that talked about the higher rates of trauma experiences in NHS staff. So there is that fragility, I think, and it means that I think people that are often attracted to these types of roles because they there's an altruistic desire to help, to care for people, but also alongside that there is this vulnerability to mental health difficulties, and this is where I think things like therapy, obviously. I'm a big advocate for coaching as well. I think can be helpful in a work setting, especially if you maybe don't want to engage in therapy. So I think both those things can really have a really protective effect on a person, even if there is this vulnerability to mental health difficulties. Yeah.
What I love is that I think coaching has become the new therapy.
Yes.
But that's such a good switch, because therapy seems really scary.
Yeah.
When I was really struggling with stress in prison, I went to see the company therapist, and I had a half an hour chat with them. They actually told me I should leave. So because they said that you're not going to fix this prison. I was one man against 1,000 inmates trying to help them all and failing miserably because there was not enough resources. But I love the fact that coaching has come to the fore, because the language around coaching is much more supportive, it's much more performance related. And we all need a coach. Whereas not many of us would think, I need a psychologist.
Exactly. And I mean, I think related to that is the fact that, we spend so much time at work, and we have an identity. So much of our identity is shaped by our work role as well. And sometimes that can be to, excessive degree. So if our identity is grounded too much in our job, then that can obviously create problems as well. And that's something that coaching looks at. We look at these multiple identities a person might have: a work identity, identities outside of work. So I do think that coaching, because we spend so much time at work, it's such a significant part of our identity. It's really important.
And you've got a particular model called compassion-focused therapy. Talk us through the three systems or three circles that you use when you're looking at these sort of issues.
So a model that I use a lot in my coaching work and clinical work as well is called the three systems model. It's from a therapy model called compassion-focused therapy developed by Professor Paul Gilbert. My doctorate actually looked at the application of the three systems model to employees in organisational settings. So the model itself, it's simple. Basically, the model says that we have these three fundamental emotion regulation systems. And I'll just go through and describe those each now quite briefly. So the first is what's called the threat system. So it's the threat system is activated when we perceive some type of danger, and it activates us physiologically and emotionally to enter into the fight, flight, freeze response, which most people are aware of. So the threat system can be activated by things outside of us, but also from things inside of us too. So our own it's a
primitive caveman response kind of thing.
A primitive caveman response. However, the thing about the threat system is it interacts with our thinking, our environment, and modern the stressors of modern life, all of which we've been talking about. So social media. So
that could be a threat.
That could be a threat, a huge threat. Work can massively trigger our threat system. So that's the first domain. The second is called the drive system. So the drive system focuses it's our reward system. It's a dopaminergic based system. It's the system we use to go out and seek reward. So that can be involved when we're feeling hungry and we want to have lunch, or it can be when we're at work and we're pursuing a goal or an objective, or
So a lot of entrepreneurs may have a massive drive
system. Yeah, exactly. So, and
what's the third one?
The third one is this called the soothing and safeness system.
Okay.
So this is our system that regulates the other two. So it reduces those, but it's the system we need that's associated with slowing down, rest and digest. But the interesting part about it is it's also a relational system. So when we're connected, it triggers what's called the ventral vagal system, and it leads to a state of calm, contentment, more present moment orientation. So we need the beauty of this three systems model is it focuses on all three. We need balance between all three.
Yep.
And when we're at work, all three of our systems are at play. And what I found in my research is that burnout is associated with overactivation of this threat system.
Right.
And work engagement, where we're really absorbed, energized by our work, is associated actually with all three systems. A little bit of threat, lots of drive activation, and interestingly, a lot of soothing system activation. So feeling safe and connected at work was heavily associated with being engaged in your work as well.
So that would relate back to this whole sort of retaining clients and retaining employees by looking after their needs. The soothing system is massively kind of satiated by that.
Exactly. So looking after their needs, creating a culture that is compassionate, that where staff feel like their mental health is being, valued and looked after, that will activate the soothing system, which interestingly, according to my research with 1,200 NHS staff, that soothing system activation was heavily associated with work engagement.
So actually making sure you look after staff is going to help them to engage and be productive and perform well.
Exactly. So what we know about work engagement, it predicts all these positive outcomes in, productivity, even profitability as well, retention of workforce and so on. So work engagement is a key metric of organisational health.
And this is so interesting because at Dr. Finlay's, Jared's going to be working for us doing organisational psychology, working with our clients who are directors of companies, corporations. And it's so exciting to hear just a little snippet of how you're going to do that and what that's going to do to those companies' productivity and performance. Now, we're running out of time. So finally, Jared, you've just done a doctorate. I know that's an impressive feat. I haven't done one myself. How's your own health and how's your sleep been?
Interesting question. I think definitely doing the doctorate is something where I've had to do it on top of my job, which is not something I would advise or recommend to anybody. However, so my sleep has been affected because I've had to work in the evenings, and have found it harder to switch off. And so when I'd be studying in the evenings, and I would find that I would go to bed and my threat system and drive system were highly activated. I felt wired. Plus I was drinking a lot of coffee to get through. So
you're a coffee lover, aren't you?
I love my coffee. Most Kiwis, New Zealanders love their coffee. Actually, but I drink too much.
Coffee stays in your system for at least 12 hours after you drink it. So
I didn't know it was that long.
Yeah. So hey,
really?
the first point for any Kiwis out there is to, if you want to go to sleep, bear in mind that if you drink a coffee, half of it will still be in your system 12 hours later. So if you have a coffee at noon, half of that will be in your system at midnight. Now I say this on and off on the podcast because a lot of people aren't aware, but it's a simple thing that might help with your relaxation system. It might help your sleep patterns. So maybe have coffee, but have it earlier in the day if you're going to get to sleep.
I was going to ask that question. So when would you advise the latest point in the day to consume coffee?
Now, some people are more genetically sensitive to caffeine than others. Okay. But what I would say is you're probably very tolerant because you love coffee and you drink a lot of it. So wind down slowly if you're going to wind down, because you might get headaches if you suddenly stop. But usually, we say if anyone's got sleep problems, the challenge is to not drink any caffeine related drinks after 12 noon. Because anything after that, you're just going to be pushing yourself past midnight. Where you're going to have irritable, restless sleep. And I see you've got an Apple Watch on. So, we're monitoring sleep these days. So you can monitor the depth of your sleep. And it really helps. So that's just one little tip. And that's what
really
we've got time for today. But it's been so interesting talking to you, Jared. I want to thank you for coming on. And I'm looking forward to seeing how your organisational psychology works out for our companies that we're working with.
Thank you, Dr. Ben. It's been a privilege to talk with you.
So that's it for today. I hope my guest and I have helped you meet some of your health versus wealth challenges. Now, to hear more from me, Dr. Ben, why not subscribe on your usual podcast platform? And if you like my advice or you'd like to be a guest on the show, you can email me on podcast@drfinlays.co.uk. Anyway, I hope to see you again, but for now, it's goodbye from me, Dr. Ben.